Many essentials for safe injection are included in our safe injection kits. Let's go over them. Good technique and good hygiene will help you inject more safely. Everything in this kit is designed to help you keep it safe. There are 8 things in the kit you can use to reduce risk when you inject. Use a clean cooker. When you share a cooker, it can spread dangerous viruses, especially hepatitis. It's best never to draw up from the same cooker as someone else and to only use them once. Use sterile water, like the ones in these little containers. You can get them from some pharmacies or syringe services. You can also make your own sterile water by boiling regular water for 10 minutes and then letting it cool. Bottled water or tap water aren't sterile, but can be used if you can't get sterile water. Even the water from the tank, not the basin, of a toilet can work. Filters or cottons prevent particles from getting in your shot and causing abscesses and emboli. You can use 100% cotton filters or cotton from a Q-tip, cotton ball or tampon. Filter paper also works. Many people squeeze the drugs out of used cottons, but reusing and sharing filters is dangerous. It can spread diseases and they can grow fungus and bacteria which cause cotton fever and even more dangerous conditions like septicemia and collapsed veins. If you hang on to used cottons for when you can't score, try setting aside a bit of dope instead. Use alcohol wipes to thoroughly clean the injection site before you inject to prevent bacteria on your skin from entering your bloodstream. Wipe the area from the center of the site, working outwards like this. Don't go over the same place more than once. Allow the alcohol to dry before injecting. Don't use alcohol wipes directly after injecting because they can slow healing. An elastic tourniquet is safer than belts or shoelaces because they're much easier to release. If you don't have a tourniquet, you can tie together 2 unlubricated condoms to make a safe tie. If you can't take it off quickly, it can cause skin and vein trauma, burst veins, and circulation problems. Use a quick release knot like this. Tie up after you've prepared your shot and cleaned the injection site. Untie after you have inserted your needle into your vein and registered to make sure you're properly positioned. Never leave the tie on for too long. After injecting, don't apply creams or anything to the open wound. Just cover it with an adhesive bandage and allow it to close. After a wound has closed, apply a thin layer of antibiotic ointment to keep it moist and prevent scarring. Dispose of your syringes in a secure sharps container. An FDA-approved container is best, but hard plastic containers like laundry detergent bottles can work too.
There are a few other things that are not in the kit, but would be good to have around. If you have access to fentanyl test strips that can prevent accidental overdose. If you get a positive result, you can decide to not use or reduce your risk with a small test dose, snorting or smoking instead, and using with someone who has naloxone. Ascorbic or citric acid helps break down brown heroin into an injectable solution. Be cautious because too much citric acid could damage your veins and reduce the quality of your heroin. Use the smallest amount possible to dissolve the heroin. If it isn't dissolved, add a tiny bit more. Heroin dissolves quickly once enough citric is added, so any bits left undissolved probably just filler or other junk you need to filter out anyway. Carry naloxone and encourage anyone you use with to have it too. Having naloxone and knowing how to use it saves lives. Everybody carries different things for safer injection. It's a personal preference. Just make sure you know what you need and have it with you to keep yourself safe. Don't compromise your own safety. You are worth it. Know the facts. Protect yourself.